Right.
Medications, Dr. Johnson, that's big. I take 7 different medications a day. Why do people not take them? They're the wonders of the modern century.
They are. I mean, medications are extremely important, especially when you have various diseases, especially heart disease. You know, medications, though, come with side effects. And people sometimes, instead of talking with their physicians about alternatives, will stop medications. Once again, it's about that relationship and talking about those issues. And also on the medical side, it's very important to explain to patients exactly why you're prescribing different medication so that they understand that it is critical that if something happens that we talk about an alternative.
Why do they give me so much, Dr. Lee? I take Altace, Plavix, Tenormin.
Well, you're taking all the right stuff.
Lipitor. But I've never had a side effect.
You never had a side effect. That's amazing. You are an amazing survivor, I have to say.
But you know, you probably take them the way they're prescribed because
exactly.
It's a partnership of you and the physician, and you got reality. It turns out that almost 60% of the people we write scripts for don't take them the way they're prescribed. There's not that partnership or collaboration between the patient and the physician. And it's really important. As he said, talk about side effects with your doctor. If there's a sexual one, talk to him or her and find out what you can do to avoid it.
I also want to say that...
Well, hold on.
Money. I mean, you know, this is a very big issue in our country. Drugs are expensive, and even when you have coverage, you have to pay a copay. And copays, when you add up all those medications together, copays can be an extremely significant burden. So I think that there's an economic issue, there's side effects, it's complex.
But even when there's not an economic issue, I mean, we have a famous story of our ex-president, Bill Clinton, found out he had a high cholesterol, was put on a statin, a drug to lower cholesterol, took it for 6 or 9 months, and decided after he lost a little weight he didn't need it, stopped it, and then he had a heart attack and bypass surgery. So people need to understand that if you have high blood pressure and high cholesterol, those are lifetime disorders. You don't want to be going off your medications.
Is it an all-out fight? In other words, are medications equal to exercise, equal to diet?
No, I think that it is said now that 80% of coronary disease can be prevented by changes in lifestyle without any medication. However, once you've had a heart attack, there are medications which clearly improve your situation and your survivability.
You know, Larry, a lot of people don't realize it, but in the year 1900, heart disease wasn't even the top 10 causes of death. This is the disease of modern civilization. This is what tells us that lifestyle is the driver.
We brought it to other countries, too.
Oh, yeah. We've exported it now, along with our fast food restaurants and so on. But the reality is that our ancestors didn't have this disease. They more often died of infectious diseases rather than of heart disease.
Dr. Johnson, we know minorities are at a higher risk, right, for heart disease. First, why, and what can we offer them?
Well, there are a number of minority groups that not only have more risk factors, but they develop those risk factors earlier. So if you look at African Americans, for example, more hypertension, more diabetes, more obesity, less exercise, and these tend to happen earlier and they're more severe. If you put that all together, you absolutely get heart disease earlier and you have more of a risk of death. The other thing that we have to recognize in our country is that even when you present to your physician or to an emergency room with particular symptoms, we have pretty good data that says, you know, you may not be treated equally. So that's why really not only raising awareness amongst physicians and hospitals, but also amongst patients to be their advocates is very important.
What advice, Dr. Roizen, to people of lower socioeconomic status who are not granted access to medical care?
We need to reform the healthcare system in America. We've got this horrible healthcare system. We're great if you're really sick and insured, and we're actually pretty good if you're on Medicaid, the lowest, if you will, insurance form we have. But there are a lot of people who fall in those cracks, as you said, the working poor, and those are the ones we need to help most. There are plans for getting drugs for them. A lot of the drug pharmaceutical firms now provide them. But there are a whole bunch of things you can do yourself. 1, walk 30 minutes a day, no matter what, and call someone. So you have someone who's your support group. 2 is, if you will, dump your fridge. Get rid of everything with sugar in it, saturated fat in it, trans fat, enriched flour, and just eat, if you will. Don't buy those things. And people have said, well, if I dump my fridge, should I give it to a homeless shelter? No, why do you want to kill those people? You know, what you want to do is eat just healthy. If you don't get it in your home, you're going to do a lot better. So a little bit of exercise and nutrition will go a long way.
Dr. Foley, what's the best advice you'd give someone after a heart attack?
For healthy sexual function, I use the phrase ACE disinhibitor. So A, ask, ask, ask. Ask your physicians whether or not you are capable of and able to have ongoing sexual activity. C, communicate with your partner. And E, exercise. Exercise is not just the fountain of youth, it's the elixir of love. And people who exercise regularly have better sex lives.